Today I would like to inform you of two ways that the swine flu, or H1N1, is transmitted and two proper preventative measures to do so they don't get the swine flu. Have you caught the swine flu or know someone who did? If you have, did you ever wonder how you or others caught it, or how you or others could prevent catching it? Knowing the answers to these two questions can keep you swine flu free. With only this basic knowledge, you can keep yourself and others healthy. Understanding both the transmission and prevention of the swine flu are very important, but first let's discuss how swine flu is transmitted. There are two ways that the swine flu is transmitted, through person-to-person and direct physical contact. Person-to-person transmission includes droplet contact, which occurs when contagious droplets are produced by the infected host, are propelled a short distance through coughing or sneezing, and comes into contact with another person's eyes, nose, or mouth. So basically, when somebody coughs or sneezes in your face. Direct physical contact involves touching an infected person and physical transfer of microorganisms to a susceptible host from an infected person. For example, if your immune system is already down and you're already starting to get sick and you touch an infected person, 9 times out of 10 you will get sick. This occurs a lot with medical personnel when they turn patients, bathe patients, or perform other patient care activities that require physical contact. Droplet nuclei is another important way of mode of transmission among many infectious viruses, such as influenza A, when viruses are shed by an infected person through coughing or sneezing into the air, and then you come and breathe that air. The second way is by touching inanimate objects. This is known as indirect transmission and occurs through contact with contaminated intermediate objects such as computers, telephones, and door handles after an infectious person has. Studies have shown that the influenza virus can survive on environmental surfaces and can infect a person for 2 to 8 hours after being deposited on the surface. So make sure you get out those Lysol wipes. Shaking hands with infectious people and then touching your eyes, nose, and mouth is another mode of transmission. So now that we know ways that the swine flu can be transmitted, let's talk about two ways to prevent getting the swine flu. Two ways to prevent getting it are good personal hygiene and social isolation. Good personal hygiene includes washing your hands frequently with soap and water, avoid touching your eyes, nose, and mouth, and avoid close contact with sick people. The second way is through social isolation. Per the Center for Disease Control guidelines, stay within your home until you are fever-free for at least 24 hours without the use of fever-reducing medicines. You also want to increase your social distances by moving and keeping desks at least 6 feet away from each other. So now that I've told you about the transmission and prevention measures of swine flu, let's recapture what we've learned. Today I've gone over two key aspects to better understand the swine flu. First is two ways that the swine flu is transmitted, which is through person to person and touching inanimate objects after an infected person has. Second is the two effective ways to prevent the spread of swine flu, which are good personal hygiene and social isolation. So remember, you can help stop the spread of swine flu. It is within your power. Be swine flu free, prevention is the key.